heartbeat, and my question is, why is it that I still have episodes of rapid heartbeat if the pacemaker is supposed to take care of that?
Is it the kind of pacemaker that can shock you out of an abnormal rhythm? Is it a defibrillator?
Yes.
It's a defibrillator.
Right.
Okay. So that's a little bit different than, you want me to take this one?
Yeah, I'll hand that to John.
So there are two types of devices that can be implanted. One is a pacemaker, and specifically what a pacemaker does is it looks at your heart rate, and whenever your heart goes too slow, the pacemaker kicks in to speed your heart rate up. There's another device called a defibrillator, and every defibrillator has a pacemaker built into it. So what the defibrillator does is not only does it pace when your heart rate goes too slow, but it can also detect abnormally fast heart rhythms, specifically ventricular tachycardia or fibrillation. It recognizes that you're in an abnormally fast heartbeat, and it can actually shock you and save your life from that abnormal heart rhythm. Now, supraventricular tachycardia is a fast heartbeat of the upper chamber and can be caused by extra wires in the heart that short circuit, or circles of electricity in the collecting chamber called atrial flutter or fibrillation. Pacemakers sometimes are used to decrease the burden of those abnormal heart rhythms, but rarely are they used to treat them. So I suspect that something else may be going on with Nancy, and she should probably follow up with her doctor to ask them about that. So we were talking about CT and calcium scoring. Now, in congenital heart disease, adults with congenital heart disease, you're using advanced imaging as well for some patients. When would that be indicated compared to a catheterization, say?
Right. I still think that the best modality is still ultrasound. So that's the first imaging modality that we use in most cases. But sometimes we need another modality that would give us a little bit more information, but at the same time wouldn't be invasive, like heart catheterization. So a cardiac MRI uses an MRI machine, which is just like the same MRI machine that's used for the head or the abdomen, but it has a special software to look at the heart. And we use that for specific indications. I know in the congenital world, in the world of congenital heart disease, we use it to look at usually vessels outside the heart, because those can be a little bit difficult to see by ultrasound sometimes. So if we are looking for abnormalities of the aorta, like coarctation, or abnormalities in the pulmonary arteries, the vessels going to the lungs or the veins, then an MRI would be the way to go. MRI also is the way to go if a patient has very difficult pictures. Some of our patients, particularly if they're heavy set, the pictures with ultrasound can be very difficult, and sometimes they can give us very poor information, and we resort to MRI because they can give us a much more detailed and crisp images of the heart. And then finally, MRI is good for quantification, particularly for the right-sided pumping chamber or the right ventricle, where ultrasound is sort of semi-quantitative. MRI gets a step further by giving us specific numbers for what the RV, the right ventricular volume, and the pumping function, and that could help us a lot in decision-making in specific patient populations.
And there's some adults with congenital heart disease that you can't do a heart catheterization on because their veins don't go back to the heart, and you need to use MRI to image in those cases, too. Our next caller is Tom from Raleigh County. Tom, welcome to Doctors on Call.
Yes, thank you.
Go ahead with your question.
Yes. My wife recently died of what was called sudden cardiac death, and I was wondering if you could explain what that is.
Sorry. How old was your wife?
She was 48.
Did she have symptoms before she passed away?
She had. She was growing tired the last few weeks before she passed away, and she did have shortness of breath on the day that she had died.
What was she doing, if you don't mind me asking?
Just normal physical activity,
Okay.
Nothing strenuous.
Okay, so what are some of the possibilities for Tom's wife?
In a 48-year-old woman, I think first and foremost you think of coronary artery disease. Secondly would be some kind of cardiomyopathy, which is a disorder of the left ventricle, the main pumping chamber. Either a virus has affected it or some other underlying disease. Those would be the two big ones that I would think of, but certainly in this country, sudden cardiac death is far and away caused by coronary artery disease in a person of this age.
So those diagnoses lead to something that causes the sudden death, or
it leads to disorder. Those diagnoses can cause sudden cardiac death by just causing a disorder of the heart rhythm, which is what actually causes people to die. That's the common way everyone dies. Mm-hmm. But in this particular disorder, you have a spark that gets set to make the heart become disorganized, and the rhythm basically stops. The symptoms that she manifested, such as shortness of breath, fatigue, could be an indication that she had some kind of congestive heart failure that was either undetected, but it could also be coronary disease. In women, there can be some atypical presentations of which unexplained fatigue or unexplained shortness of breath could be a symptom of coronary artery disease rather than chest pain or discomfort.
Okay. Well, that's certainly sad, Tom, and our thoughts are with you. Sudden death occurs in athletes and young folks too. What sort of diagnoses do parents and the athletes themselves need to worry about there?
Right. So in active adolescents, particularly athletes, the number one cause of death is something called hypertrophic cardiomyopathy, which is a disease of the heart muscle that causes thickening of the heart muscle, and it causes a disorganized structure in the muscle cells and predisposes people to have sudden onset of abnormal heart rhythms that puts them at risk of sudden death. And this risk of sudden death is definitely higher if they're very active or competitive athletes. And so that's the number one cause. Sometimes there are clues in the history or the family history that may bring this diagnosis to light before something bad happens. Unfortunately, sometimes it's just silent, and it's nobody's fault that it was missed. There are other causes such as anomalies of the origins of the coronary artery, unlike in the adult world where you have acquired abnormalities and blockages of the coronaries. In the pediatric world, they could just have formed abnormally and just came from the wrong place in the aorta, and this predisposes them to get kinked and get suddenly blocked during exertion. We call this anomalous origin of the coronary artery.
Very good. So certainly your child should be evaluated by a physician before participating in sports to look for those defects that you all have talked about. Yes. Well, we've been talking about heart health with Dr. Anthony Morise and Dr. Malek Yaman. Thank you both for being with us tonight. If you'd like more information, talk to your family doctor or visit our website at wvuhealthcare.com. For Doctors on Call, I'm Dr. John Phillips. Good night and good health.
Doctors on Call will be back live September 22nd. Join us then. Major funding for Doctors on Call is provided by a grant from the Milan Charitable Foundation. Other funding is provided by the Health Plan, a health maintenance organization serving West Virginia and Ohio since 1979. By the Center for Organ Recovery and Education, supporting Volunteers for Life through organ, tissue, and corneal donation. By Health South Rehabilitation Hospital, serving your rehabilitation needs in Morgantown and Fairmont. And by the faculty and staff of the Robert C. Byrd Health Sciences Center of West Virginia University.
This has been a production of West Virginia Public Broadcasting.